There are many applications to using abs and right in a physical therapy practice. First, you can use abs and right to teach your patients how to get into neutral spine and obtain neutral spine throughout movement. Second, you can teach your patients how to initiate abdominal activation. Third, you can put your patients in a prone position and get them to isolate the activation of the transverse abdominis. Fourth, you can increase hip flexor flexibility and hip extension range of motion by activating your core. So when you could use your patients do a Thomas stretch, put the belt around their waist and have them maintain green zone, which is neutral spine, while you stretch the hip flexor. Fifth, you can use abs and right with acute back pain. You can use it as a reciprocal inhibition tool for the paraspinals and the multifidi of the low back. You activate the core, set them in neutral spine, and maintain that position for 3 to 6 minutes, and that will cause reciprocal inhibition to any of those back spasms that are going on in the low back. You can use abs and right to teach activities of daily living, to be able to get them to maintain green zone in all their activities. You can, once they learn the feeling, you tell them to brush their hair while standing in green zone, ride in a car while they're in green zone, sit at their office desk while they're in the green zone, lay down and fall asleep at night in the green zone. You can use abs and right to teach core muscle activation throughout all the exercises you give them. Any of the therapeutic exercises, you can instruct them, get in the green zone, get in the green zone, and they'll be aware of that position after wearing the belt, that they now can do their exercises in neutral spine with core activation. You can teach your patients how to do diaphragm breathing, to be able to breathe in and out without relaxing their deep inner core muscles. That makes a big difference with runners, somebody that's always having injuries. They tend to relax their core muscles every time they take a deep breath. And if you get them to take a deep breath while they're in the green zone, they're able to get their diaphragm moving separately from their transverse abdominis and other abdominal muscles. Abs and right helps with a lot of anterior shoulder pain too. If somebody's always in an anterior shoulder posture, you can get them aware of neutral position, which instantly brings them back. After they're in that position, it's a lot easier to do retractor strengthening with their shoulder blades and open up that anterior shoulder. It's also easier to do a pec stretch or any kind of external rotation or horizontal abduction stretching with them, because they'll be able to maintain neutral position and not rotate with you when you pull back their arm. Abs and right can also be used with muscle energy techniques of the pelvis. If you're having an anterior rotation on one side, you can use the abs and right to give them cue to maintain isometric contraction of their abdominals as you try to mobilize them into a more neutral pelvic position. You can use abs and right on the shuttle or a leg press. You try to get them to keep their body in neutral spine, not rotate their pelvis as they use their glutes, not use their back extensors when they're supposed to use their glutes. So you wrap the belt around, put them on a shuttle, put them on a leg press, and keep it in green zone throughout that motion. And the best part about abs and right is it's a universal coaching cue. You no longer have to give your patients 10 different verbal cues to try to get them to activate their core. You can just simply say, get in the green zone, and they now will know what that feels like. Instead of having to say, tighten your abs, suck in, draw your belly button into your spine, push your back lower, hold your spine, tighten your abs. You don't have to use any of those verbal cues. You simply say, get in the green zone, and they'll know what that means. I hope you're able to use abs and right in your physical therapy practice and get better results with your patients in a less amount of time, and more permanent results in less amount of time.